Cellulitis symptoms, causes and risk factors. Cellulitis is a bacterial infection that affects the skin. Cellulitis causes include the Streptococcus bacteria and the Staphylococcus bacteria. The bacteria enters the skin, usually through open cuts or wounds, then reproduces at a rapid pace, triggering cellulitis symptoms. Number 1. When the body attempts to protect itself from the bacteria, cellulitis symptoms occur. Cellulitis risk factors include having open cuts, wounds or scrapes on the skin, or other skin disorders such as athlete's foot or eczema. Number 2. Cellulitis symptoms worsen over time, which is why it's important to treat cellulitis causes and prevent the bacteria from spreading. Cellulitis symptoms. The parts of the body that most commonly develop cellulitis symptoms are the legs, hands and anywhere on the skin that has an open wound. Symptoms include redness of the skin, which worsens as the infection spreads, pain on the surface of the skin or pain when pressing on the affected area, changes in the color of skin, turning orange or bright red, developing puffs of fluid like blisters. Symptoms of a fever, including fatigue, weakness, chills and nausea. Cellulitis causes. Cellulitis is triggered by harmful microbes that enter the body and cause inflammation. The most common cellulitis causes are the Streptococcus bacteria and the Staphylococcus bacteria. The bacteria reproduces and spreads quickly, causing infections. It enters the body through open cuts and wounds. Certain risk factors for cellulitis can also make the body more susceptible to developing an infection. Number 3. Cellulitis risk factors. The biggest risk factor for cellulitis is having an exposed cut, wound or scrape. For even a small cut that is not cleaned properly can be a breeding ground for harmful bacteria. Other risk factors that cause cellulitis symptoms include athlete's foot eczema, shingles, chickenpox, cystic acne. Any skin condition that causes cracks to form in the surface of the skin can allow bacteria to enter the body and cause an infection. The weakened immune system, poor gut health and poor hygiene are also common risk factors for cellulitis. When the immune system is weak, the body is at risk for many different viruses and bacterial infections, including cellulitis.